I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. So pain is such an important topic for ourselves and for the people we care about. And it has many dimensions we're familiar with, the kinds of things people do in the United States for pain, intuitions many of us probably have about where the yield is and where it isn't. Today, we are fortunate enough to be joined by Dr. Ryan Wohlfert in Michigan, who I've had the privilege of talking to recently to get ready for a summit. Dr. Ryan Wohlfert is a certified chiropractic sports physician. He's a certified chiropractic biophysics physician using a specific protocol for spinal and postural correction to break free from chronic pain, disease, and organ dysfunction. He's also a certified mindset specialist, helping people retrain the mind-body connection for optimal health and performance. He has over 20 years of education and clinical experience, and he's helped thousands correct their mind and spine to break free from chronic pain, eliminate dependence on a very broken medical system, and make simple, pain-free living possible. Dr. Ryan, thanks for being on the podcast today.
Thanks for having me, Dr. Rob.
So let's start with how big a problem chronic pain is in the world.
Well, it's one of those that I would say most people have had the experience of having. Chronic pain is a little different, where it can definitely affect your activities of daily living, but the tentacles that chronic pain has in all these other diseases as well, that these chronic diseases, or even and how they can progress and get into chronic pain. Specifically what we talk about with chronic pain is like migraines and headaches, and arthritis is a huge one that I don't know why I forget sometimes, because it's so common and people think that, it's just arthritis, I can't do anything about it, which is totally incorrect. There's definitely things you can do about it. Peripheral neuropathies and neuropathies in general, fibromyalgia, that's another big one when people hear chronic pain. And even I put chronic fatigue in that too, because that is a physical ailment. In the US, the numbers are about 70 to 80 million people live with chronic pain, deal with chronic pain, try to manage it, which is one of my least favorite words, is managing the pain. Is I want to help people, like you said in the intro there, break free from it, and showing them tips and strategies, and showing them how to do that. The one thing that really hits home with me, like how big of a problem this is, again, I'll narrow it down to the US where I am, is that so chronic pain is the number one cause of long-term disability in the US. So you can't work, you can't, you just don't feel like working. You don't, the pain limits you with what you feel like you can do. You lose who you were, essentially, especially if it's something that has come on with, for some reason, which we'll probably get into, of why we do experience pain, why we feel pain, and why it doesn't always have to be where you think the injury is, which can be a confusing thing. So that is why it's such a big problem. Is one, just the prevalence of it, and two, there's not a lot of great natural answers to get rid of it, because you could have back pain thinking, okay, it's, the back pain is there, which actually the cause of it is somewhere else. It could be in your, the neck area. It could be just in the brain, and the neurology that's developed around, and the neural training, the neural programming that goes on in the brain, and why you feel the pain in the low back, why it's signaling there, when actually that's not where the actual problem or cause is.
Well, I'm sure that people are just going to be so interested to learn more about this because of their own pain or somebody they care about. This affects us or someone we know. It's a given, just statistically. And also so poignant to see these disabilities manifest, see people not be able to chop wood or go to the store or take a walk or pick up their grandkid, horribly impacting of one's identity.
You read my
And
mind right there. I mean, that's huge, especially just the whole kids part of it, picking up your grandkids, getting out on the floor with the kids, the grandkids. Help, just if we want to put it in one like succinct umbrella, is just enjoying your life. Feel like you're not yourself anymore. Feel like you can't do the things you used to, and you tell yourself, well, I can't do that. And that plays into the whole brain neurology part of it.
Well, let's segue into it then. So what is it from your perspective? What is pain? And on this part here, as we prepared for today, this idea of what people are doing, I suppose we need to talk about this pain, surgery, etc. And as we segue into that, I should add a qualifying comment. I always try to be transparent as a host. And I would say that many of the people I take care of in functional medicine, they come here feeling that the system's broken. And then some of my conventional medicine colleagues feel this sense of chagrin when I say broken system, right? They feel like, oh, come on, we're trying here. And so I should say that I think the father of functional medicine, Dr. Jeffrey Bland, has identified accurately that the 20% of stuff we do in conventional medicine that's life-threatening pneumonia, a brain tumor, a broken bone, blood pressure dropping, and things we use in the ER. I find the conventional medical system in the United States works well for that. I'm pleased with it. I'm concerned as a functional medicine doctor that 80% of what we see and treat has a complex backstory that isn't understood and leads to a lot of unnecessary suffering. And to me, that's the broken part that gets fixed in these other settings. So certainly not trying to put words in your mouth, but I did want to add some, I guess, just my own perceptions as the host.
No, I definitely agree with that. When I say broken medical system, it is talking about more in the area of chronicity and trying to put the acute model, these acute solutions to a chronic problem or a chronic issue. That is the part that's broken.
Well, and I mean, the numbers support your assertion. Just when we look at this isn't a good measure necessarily, but when we look at people's reported outcomes or objective measures of outcomes and the amount of dough we're throwing at this, we're below 30th in the world for outcomes and top for, so throwing money at this and procedures and drugs isn't working. And pain, I'm glad we're talking about it today also, because I was trained in an era during which the opioid epidemic manifested. And I'll guarantee you, everybody coming in with over 100 equivalents of morphine is hurting. So the irony is, you'd think when you meet them and they're taking that much opiate, their problem has to do with dependence and side effects, not pain. Just the opposite is true. So let's talk a little bit about what people are doing that isn't working.
Well, that's definitely, you led right into it, because still the number one treatment for pain in general and chronic pain is prescribed medications. So opioids still, Vicodin, even over-the-counter stuff too, which people think is innocuous. It's not going to hurt you, but we know done over time that it can. The scary part too is, of the 10 most commonly prescribed painkillers, they're also considered to be the most addictive. And I love how you mentioned that, even it's not necessarily that they're not in pain, that it's addiction, and that's why they keep taking them. But no, they are still in pain even when they're taking these pain medications. And the stat I don't love, but again, it points to that fact that we're trying to fix it. People, I think a lot of times in general, think fixing it in pain means I'm going to have surgery to fix it, where 75% of the time with low back surgery fails in the fact that they're still taking, so 75% fail in the fact that they're still taking pain medications after the surgery chronically. So it's not really fixing it, and it's getting to the core of it issue. It's getting to the cause of it, which we're always trying to find out, right, Doc? It's always, and it's not a one thing. It's a lifestyle. It's healthy living. That's why I say make pain-free living possible. It doesn't mean we're never going to have aches and pains. It doesn't mean we might get injured, but it means that we can live a lifestyle implementing these healthy lifestyle principles and practices in order to combat and counteract the stressful things that we do to our body and our brain in general too. So that's why, you know, people are trying to use to fix it, but it's been shown to be ineffective in actually fixing and correcting the problem.
And I don't know if this is salient, but as we segue into this next part, I do want to share an anecdote I hadn't thought about for a long time that might be of interest to our audience, because for quite a while now, I've said to people, you are not your MRI. So many times by the time people meet me, they've been imaged or I end up imaging them. And I took care of this person in Montana who was 6'5", 6'6", really tall, built like a linebacker, and absolutely loved laying sheetrock. So this person, I think by the time I met this person, they were over 60, and they would carry sheetrock all day, every day for around 40 years when I met them, which you and I both know, like the musculoskeletal demands are 10 over 10. This is just off the chart for like torsional loading, right? Off axis carry, just, and the thing was, he only had 1 over 10 discomfort in his back, and then he got rear-ended. So somebody hit him going 50 miles an hour when he was parked at a stoplight. And then the folks helping him said, oh, well, you've got all this degenerative change and where the little, you know, delicate facet joints articulate with one another and all these bulging discs, and there's a little crowding at the nerve root openings. That's why you hurt. And I said, well, if that was why you hurt, then you wouldn't have had 1 over 10 discomfort before you got rear-ended. Yep. So we focused a lot on things like central sensitization. What's your brain telling you about the information coming in? So I don't know if that's a useful anecdote or not, but I'm really excited today for me and our audience to learn from you. What is going on then about what do people really need to know about where pain comes from and how to fix it?
You know, that's that anecdote is really good. I mean, I love that because it puts in the whole mind and brain aspect of it. And that's the interplay that we have to deal with, right? Is because you want to be honest with, this is what your spine looks like, or this is what your body looks like through X-ray, through MRI, whatnot. But tempering that with, just like how you said, this was there before an accident, but why is it causing such pain right now? If that was the cause, then why didn't you feel it before? Well, now you get that, you know, that little weed growing in your brain, like, oh, maybe I'm not, you know, whole. Maybe I can't do this stuff anymore. And the brain is such a powerful, well, it is the most powerful thing that we have. And it just sends, you know, all this information, the communication down to the rest of your body. And you don't even know what's happening. Just like you don't have to say, and that's why I'm just addressing this right now, is you're not consciously saying, okay, lungs, breathe. No, you can do it consciously, but it's an unconscious thing. Your heartbeat, it's not like you're trying to tell your heart to beat 60 times a minute. It just happens. You're not trying to digest the food every time you eat, like consciously. It takes care of that. And the brain and the body, the communication between that allows it to do so. So when we get some type of stress or threat onto or into our body, whether it's a physical, whether it's a chemical, whether it's a mental, emotional thing, in those thoughts, again, like with the patient that you saw, like those thoughts that build and think, okay, maybe I shouldn't not be in pain, right? It's normal because they're saying this is what is causing it. But, you know, I say that, you know, to answer that question as well as where does the pain come from? What can we do to fix it? We're definitely going to get into that, because that is, you know, it can be a confusing thing. Like, where does this pain come from? So I want you to think of pain as a response. It's very simple. It's a response that your brain is giving to your body, wherever it is, saying, hey, I need help because something has gotten out of control or out of its ability to manage or cope with or deal with. So it's sending you the message, sending you that symptom, that response that, okay, we need to do something different. And how, now, why do I hear on a pretty much daily basis when I'm in the office, the physical location is, oh man, why I didn't do anything different. Why I've never had this before. I've never had this pain here before. I've never had that before. My knee has never hurt before. I've never had headaches before. I didn't do anything. Like, those are the main things.
Yeah.
So it's important to understand why. I don't always ask that because, or encourage people to ponder that because it can, now your brain, it can just balloon into something else and explode into, oh my God, unless you know how to deal with it. So a simple analogy I give is the threat bucket, the stress bucket analogy. So every stress, not just mental stress or, negative thought that we have, but also physical type stressors, accidents that we've been in, poor posture, hunched over our phones, hunched over our, watching TV, sitting down too much. Our lives now are a lot of times set up for us to be, chronically in a poor position, whether it's sitting down, whether it's even lifting, whether it's, standing, walking, whatever. So physical stresses, it could be chemical stresses. So again, the things that we eat, drink, the lotions that we use, the home care products that we use, these are all chemical stresses that can go into our body. And then also the mental stresses, emotional stresses that we have throughout life. So every thing that's considered a stress or a threat, the brain's like, all right, it puts it into our stress bucket. And as that water level rises, it gets to a point where it can hit this threshold where if we didn't have this threshold and that bucket just kept filling up and it got to the top and started overflowing, well, now your brain thinks it's going to die and thinks you're going to die. So it's like, well, I don't want that. So it will compensate and do anything it can for that not to happen. So it's got this, little spigot or valve about, halfway, 3/4 of the way up the stress and threat bucket. And that level can be different. So that when you hear people say, well, I have a high pain tolerance, that's probably essentially what they mean is that valve is higher. But once it hits that, it lets out that response. And that response is, in our talk today, is chronic pain or pain in general, which can turn into chronic pain if we don't actually fix the issue, which is one, the stress going in, but then also counteracting that with these healthy lifestyle practices. Today, we're going to talk a lot about spine and posture because I don't think your audience and the world in general has understood that and how big of a problem that is, because we say, oh, my posture is horrible, but we don't equate it to what that means for your health, right? So that's what can happen. It's not like it's getting rid of the stress and just letting it go. No, that's still there. Your brain is giving you the response to that in the form of pain. And, we could even get into these responses could be other things than pain. It could be an emotional response like anxiety or depression. It could be infection. It could be a lowered immune system. Anything that will get your attention to get it addressed. That's why symptoms aren't necessarily a bad thing, which they, again, by themselves, they're not. They're our body's alarm system. Just like if you have I like analogies. If you have, a fire going on in your house and the smoke alarm goes off, the firemen run in and you say, can you just knock the smoke alarm off? Or if you yourself take the batteries out of it when there's an active fire going on. So we want to fix the fire, not just fix the symptom by covering it up. And, we use that as an example if you're taking pain medications where it just dampens your brain's response mechanism.
Yeah.
So, yeah.
Yeah. Excellent. Thank you so much. As we segue into posture then, The thing that I love about what you said and this recurrent motif with thought leaders, the best phrase for it I've heard in the last month was getting to interview Mark David from the Psychology of Eating. And he kept using the phrase, what's the brilliant reason our bodies do such and such? What's the brilliant reason that we have these responses? And so that analogy you gave, we don't get mad at the firemen for charging in, though I suppose some of us, when we're not at our best, do. It's a pretty darn good analogy. Hey, what are you doing in my house? You damaged my door. Rather than saying, well, a certain amount of stress distress mounts, and if we can compassionately engage with that brilliant reason, our bodies are giving us these messages, then we're not making the mistake of hating our pain. And because I've done a lot of primary care, I would say now that's one of the biggest mistakes of all. It's ignorance, not malice, but it still creates a super stuck situation for people to have an adversarial relationship with their pain.
Yep, stuck. That's a great word. Adversarial relationship is these are all protective responses. You know, our number one goal, the brain's number one goal, is for us to survive. It does that at the expense of how we perform. It does that at the expense of how we feel. As long as it survives and you're in pain, it's fine. The other thing it does is sometimes the brain, or no, I should say sometimes the brain likes to stay where it is. It likes comfort. It doesn't like change. So then now if we try to change too many things, well, now it's got to, use too much energy for that. So we stay stuck. And that's a great description of what we say, stay stuck instead of moving forward, because yes, we're in pain, but at least we're still alive.
Yeah. All right. Well, let's talk about posture, health of the internal organs, the gut, lungs, and brain.
Yeah. Oh, heck yeah. I mean, this is such a misunderstood, and I don't even like the word secret, but it is. As I go through this, people are going to be like, well, yeah, that makes sense. Okay. Yeah. But it just depends on how can we incorporate that into our lives and make it feel a difference. When I was a kid, I had migraine headaches. That was my first experience with how my spine affected pain, but overall health. Because I remember my mom, when this was after a few years after I had been going to a chiropractor, because I first went because of that signal, that pain response of migraine headaches when I was 13 years old. But then after that, she noticed if my posture, if my spine, or if my, wasn't functioning, again, this is going back and just correlating what she saw and translating, is she's like, you're ornery. We got to get you into, see, because it affected my emotional health. But so yeah, it's got this, it's fingers and everything, because the spine is the core of your body. We talk about you got to work your core, and people say, think it's the abs. What's the core of an apple? It's down the entire center, and that's where it is. The brain's got to get the signal, that physical signal and communication, down through the spinal cord, which is protected by the spine. All right. And all those nerves go into every single cell, tissue, and organ. So, I mean, I love these quotes here from like Rene Callier. He's a MD musculoskeletal specialist. He's no longer with us, but to live a long, active, energetic life, few things matter more than good posture. And this is for like one of the top rehab specialists in, I think it was the USC. He was the clinical director there. And then this other one, posture, and this is from the American Journal of Preventive Medicine, posture affects and moderates every physiologic function, from breathing to hormone production. Spinal pain, headache, mood, blood pressure, pulse, and lung capacity are among the functions most easily influenced by your posture. And I say that because where your posture comes from your spine, and if you're in a poor posture chronically, then it's going to affect your spine and vice versa. It's just going to it's not just all about the muscles, which we'll get into. That's part of it. But if your spine is so distorted, and I actually got my spine here. All right. I got this right next to me.
Welcome, Spine, our second guest of the day.
Yes. So here, I just took this out so you could see it. So this is on the inside of us. And I've said this for years too, if we had our spine on our face, or people could see it like internally, we probably take better care of our spine and posture. Even though people can see our posture, but the way our society is now with all the the things that we do and the actions that we take, again, on the phone, bent over like this. So let me show you what normal is, and normal should be, from front to back. If we're looking front to back, we want the spine up and down. Again, I'm not sure if that is or not, but just like a building, that gives it a nice, strong foundation. Now, I think people get that, we don't want to be shifted off to the side, bent, shoulder low, head tipped. But now from the side, this is huge, because what the spine does, the spine protects the spinal cord. And if the spine doesn't have that posture front to back, straight up and down, and these three equal curves from the side, all right, in the neck, the mid back, and low back, again, balance between those. It's about 40 degrees. For simplicity, we'll say 40 degrees in each of those. Then the spinal cord can be nice and relaxed. Think about a rubber band that's not tense. We're not pulling on it. No, the spinal cord can be nice and relaxed. The brain can get the energy and those signals, communication down to every cell, cell, tissue, and organ in your body, and allow it to function. Again, what did we say? Affects and moderates every physiologic function. And we'll do this test in a minute. Don't let me forget about, if we hunch down our posture, how does that affect our breathing? How does it affect our mobility when we do that? We'll do that as an assessment. So not only does it protect there, but it gives shock absorption. A lot of people think that the shock absorption, because of what they've been told, maybe the discs that separate, that are between the vertebrae, they don't really provide too much shock absorption. It's these curves that do, because when we have curves, think about a spring. Again, it's got that absorption capabilities. So when we have curves, it absorbs. And if you're watching, you can see what I'm doing here. If you're just listening, I'm basically curving my finger and we're just pushing down on this. It has give, but the straighter that is, and now it doesn't absorb that shock, doesn't absorb that stress, and all that gets placed down on the discs, on the joints, and makes them wear out too fast. All right. So that's how the spine should be. But because of our activities we do throughout the day, and too much of them without counteracting it. I'm not saying you have to quit your job. I'm not saying you have to throw away your phone or computer or, whatever you love doing, but we better be doing things that we'll talk about to counteract that if you want to have a long, healthy life. Because this is, I think, the biggest wow I get when I mention there's been multiple studies done showing how in this called hyperkyphotic posture that so many of us have, and how it affects in basically collapses the thoracic part of your spine. And I'll bring this out so you can see this too, but where it's like that. Well, now it's stressing the spinal cord. Again, it's like pulling on that rubber band. It's shown on MRI that in this type of posture, where it's there and affecting the thoracic spine, that the spinal cord is butted up and it is butted up against the back of the vertebrae. So it's like forming a callus on the spinal cord. That's been shown on MRI. So in this posture, that has been shown to lead, and I want to make sure I articulate this so you're not thinking, so I'm not saying that you're going to die 15 years earlier, but it can lead to up to a 15-year loss of health span and lifespan. And this has been Spine Journal, American Journal of Geriatrics. There's been a few other, I got it here. I don't have it right off the top of my head, but and here's why. Let me put this back so I can, there I am. Okay. And why is that? Is when we get in this posture and it makes us age too fast. So this is one of the secret keys to healthy longevity, as I call it, is in this here, physically it affects and makes our lungs not work very well or as well. It makes the heart work harder, makes the gut, work harder to digest food, because what's in, this area here is the heart, the lungs, vital organs that help us to live a healthier life. That we say, okay, nutrition is important. Well, if we can't digest that food because maybe there's just physical stress and it's like that threat bucket is going nuts and it's giving us pain, but we don't equate our posture to our gut health, then we might start eating good foods, but not address the posture, which will help improve your digestion as well. So that's the physical part. And even the neurological part. Well, now, remember I said that in that type of posture, and I'm just going over this one, there's hundreds of other postures that we could be in. This is the most common one. Shoulders rolled forward, thoracic spine collapsed essentially, head forward. It's like a rubber band stretching the spine. The spinal cord is losing its function, some of its function, going to the heart, going to the lungs, going to the gut, going to the thyroid even, because those are the nerves and nerve roots that go to those areas. We don't often equate that to those. Now, if you are in pain, sometimes I'm thankful that you're in pain because it brought you into an office where you feel like, okay, that's why I'm here is for pain, when we see this is also could be related to your thyroid dysfunction, or could be related to your IBS, and could be definitely related to the energy levels that you have. So as we correct that, a lot of these other health symptoms go away because we're just counteracting the stress that's on your spine, on your posture, on your life, allowing your body to heal and get that communication to the rest of the body, from the brain down to the rest of the body. So so what I want everybody to do who's listening is I want you to feel the effects of this. So I want you to basically slump your shoulders, take your head forward, like stick your chin out, and take a deep breath in and out, in and out. You see, even my voice is affected when I'm in this posture. Now, try to get up a little bit straighter. And if your posture is so poor or kyphotic that it's hard for you to even get in a upright posture, then you know that there's more than likely some degeneration that's preventing it. It's like rust on something that needs to be. It doesn't mean it can't be corrected. It just means we have to find out what can be corrected on that. So now upright, head up over your shoulders. Now take a breath in and out. It's a lot easier, isn't it? So think about if we're like this day after day, or let's even tail it back a minute after minute, hour after hour, day after day, week after week, it's going to keep degenerating in that position, making it harder and harder for you to breathe, for your heart to beat, for your your stomach to digest, your intestines to absorb, your thyroid to get, all the metabolism going on. So that's why it's such a huge health and pain, to help with chronic pain. That's how it affects the organs. But think about the stress that the ligaments, the bones, the muscles are under in that position. It's in a chronic strain type position where it's finally like that threat bucket, your brain fills it up. It gets to a point like, oh, what? I can't do it anymore. So that's why when I say, people ask, why do I have pain? Why? I've never had this before. Well, I've never had this before. I didn't do anything different. Sometimes I say, well, maybe that's the problem. You haven't done anything different. You keep doing the same things over and over again, repetitively, especially in a poor posture, without counteracting that. And I've noticed on myself as I'm working on a computer, like I'm talking to you, I have a standing desk here, but even with that, that's not going from sitting to standing desk doesn't mean, oh, everything's cool. Yes and no. We still need to move, and I can still feel myself going like this. So I've made a conscious effort just bringing my shoulders back too, making sure my head's back. As a little tip that I use is having these little triggers, whether you need to put a timer on your phone, whether you need to, just equate a good postural habit with something that you're already doing every time you take a drink of water. All right. Check your posture, be aware of it. So that's like how our body, how our posture, how our spine affects our organ health, and even affects our overall health, our organ health, and leads to chronic pain.
Very cool. Very cool. I'd like to add a contextual piece that may help our audience as we segue into actions that people can take. And so one of the things that I'm an expert in is sort of the default American stance. If you just talk to Joe or Jenny Bag of Donuts, right, about what they take away from the conventional perception, for some reason, I don't know why, there are experts who have elucidated this, but I haven't and won't end up with the time to be a medical historian and figure out the last 100, 200 years of where we got it right and where we got off track. But conventional medicine's become fascinated with disease. And so in conventional medicine, it's acknowledged if there's a spinal cord tumor that warrants surgery, okay, that's disease. So what they say when they train, Institute for Functional Medicine trains people like me who need a bigger toolbox. They'll say, okay, here's disease. And then when the conventional doctor says to the person, you aren't diseased, usually the words they use, and I feel like this has an energetic belief problem that's created. Unfortunately, the words used by conventional doctors, including me before I got this training, is you're fine. So the person's not heard because they know they're not fine, they're symptomatic. And this is part of their disenchantment with conventional medicine, is they don't feel heard. Now, I think the conventional doctor means you're not diseased. I can't find disease. And in functional medicine, applying functional medicine clinical practice, the 1 week intensive, day one, they say there's a spectrum from disease to vitality.
Yes.
And so when I hear you educate us today, I think about these suboptimal conditions occurring due to these alignment issues. And there's then 100 things happening in toto, which are depleting and diminishing and distressing. And when we start to remedy those things, we move. Many of us, again, don't have a spinal cord tumor that needs to be removed surgically. We need to go optimize underlying conditions to get to optimal health. And so I just wanted to add that it's the most poignant thing for me. The number one thing I hear in my office is people say, I feel heard, which I'm really proud of. But it's because of the functional medicine training that I'm able to say to them, for whatever reason, folks in other settings have been telling you they're not diseased. You're not diseased, and that's probably not what they meant. In their heart of hearts, they probably meant, I can't find a pathology diagnosis. Keep moving.
That's beautifully put. I love that example, because you're right. It's not 0 or 100, where 100 is vitality and 0 is disease. There's that spectrum of in everything, these healthy lifestyle principles. Today, we're talking about spine and posture that move you towards that vitality of 100. Yes, that's beautifully put. I love that.
Well, so what do people do? What are their action items then? You've set the stage.
Yes. So I want everybody to basically, whether it's now or when they're done listening to this, just look at your posture. You could either use your phone. Again, just like there's no good or bad, social media is not good or bad, your phone's not good or bad, but how we use it. So you could set it up or have somebody take a picture of your posture, like from the front and then from the side, or even if you can just kind of look at yourself and take inventory. So from the front, put your feet, again, you can't see my feet here, but about hip width apart, just march up and down, nod your head up and down, side to side, and then just look straight ahead. And if you have a full length mirror, you can do this, in a mirror. The side one's a little bit harder to do without a picture. And you just want to line up or make sure that basically if you have a straight line or a plumb line coming down from the ceiling, like, and you want your glabella, like right through here, nose, mouth and chin, your sternum, your breastbone, and your pubic bone, we want those all lined up. Okay, pretty simple. Check to see if one shoulder is higher or lower. Check to see. So your head could be, and I have a nice long neck, and I'm pretty good at this because I have to demonstrate it a lot. Posture isn't just the slump posture. It's also, so look, now my head is shifted over to the right, head and neck. So now that can create stress on those muscle, nerves, joints, spinal cord, and my posture. So, and spine in general. So that is something that you want to do. Just a quick check. Is one shoulder lower? Are you shifted to one side or not? Is your breastbone and pubic bone lined up? Those types of things. All right. And then from the side, we want your ear. So if you look at me from the side, we want our ear lined up with like the AC joint. So that's usually where we're like this, and I'm wearing a dark shirt, so it's kind of hard to see. You're here, and we want the AC joint, that bone right at the top, lined up there. The outside of our hip, the bone is called the greater trochanter. We want that lined up, and then the ankle. So we want those just overall posture if we don't have spinal x-rays. We want those lined up as a good general rule. Now, if you find yourself, and I'm going to give you probably the top exercises, like 2 or 3 of them, that people can start on after they look at this posture. And I'm going to do this one because this is the most common one. That forward head posture, roll forward shoulders. Yes, I do like, again, just pulling the shoulders back, taking the chin back like that. Not necessarily looking up, but this is just a general exercise. So that right there, okay? And what you can also do is if you find, and you mentioned, what was the posture, the typical American posture when you're talking to somebody. I think you mean this one where I know so many people I see there like this, where their hips go forward. Again, you can't see me doing this, crossing their arms in front of them, hips go forward, mid back goes back, and we're just slumped down like this. So you can even just be aware if you're looking down at yourself, look at your ankle, look at the outside of your hip, and then again, roll the shoulders back, head back. And it probably will feel uncomfortable for a lot of people because they're not used to that. It takes the retraining process to where you might get, if you focus on this, and I'll give you an actual exercise with this as well. If you focus on this day after day after day, you might get sore. You'll probably get sore in the mid back and the muscles because now they're starting to work a little bit differently. Instead of being chronically strained, now we're actually contracting them a little bit. So I love this exercise too, is you can, and this is best done, I would say, sitting, but you can do it in any position. You clasp your hands together, you put them behind your head. All right, head and neck. If you can't do that, then you might have to keep them separated somewhat, but I'll show you the ideal way to do it. So you're here, you take the elbows back. So it's like your chest is going out a little bit. Take your head back into your hands like you're tucking your chin. Keep those elbows back so you see it's not like, it's not there. So you're going to feel a nice stretch across the chest. You're going to feel the muscles between the shoulder blades working. And then you can hold it there for 5 to 10 seconds to where you're pushing the head back, elbows back, chest up. And I would say also to breathe through your nose while you're doing this. I'm not breathing through my nose because I'm speaking, and it's you can't really do that. So hold for 5 or 10 seconds, and then you can relax. It feels so good. So you can, put a timer on every 15 minutes. Do 3 to 5 reps of those every 15 minutes. And if you get good at that, you can even add a little rotation to where you're here and then rotate side to side. But with that, you should feel the back of your spine, like neck, upper back, mid back muscles working, and then stretching across your chest. And just, oh man, I just feel the circulation just going through my body. Oh man, it feels so good. Like this tingling, you know what I mean? This tingling that you get.
Yeah.
Warmth. Oh man, it feels, and that's what I do, like 3 or 4 reps right there.
Yeah.
But go until, again, it shouldn't hurt. All right. It might feel a little uncomfortable, but it shouldn't cause pain. So that's one of my favorite exercises, especially for the postures that I see quite a bit.
Awesome. Well, I think that this is probably a good point to mention that you have programs people can do with you and your team, right? So
yes,
they can delve into this. And I think it's one of the coolest things about life in 2022 is that there are thought leaders and teams and programs that people can access across state lines to get better. So they can go work with a state-of-the-art team. And that's really cool. There's certainly a lot of challenges that come with 2022, but one of the great things happening, in a way, it's even more important now because of the way the pandemic's pinning people circumstantially. So
yes, and I have an exciting new master class I'm working on. It's called the Chronic Pain Master, Natural Solutions to Chronic Pain Master Class. Yes, I mean, this is bringing like spine and posture is one module of it, if you will. But then we're also going to be talking about brain neurology and how that equates to, we touched on it briefly, and exercises. I'm bringing the science and the application in brain, in the mind, in the spine and posture, detoxification, sleep, and putting it into a cohesive, unified program and masterclass that people can learn from.
Fantastic. Where can people find you, Dr. Ryan?
I would say the easiest way right now is totalhealthspine.com. Go there for sure. And even if you did totalhealthspine.com/chronic pain, if you would like to talk to me, book a house call with me, not where I will go to your house, but a virtual house call. I can do that too. All right.
Yeah. So cool. What a blast getting to talk with you. I really appreciate your time today.
And I definitely want to have you on my in my Be Your Own Guarantee Facebook group, so you can, I want to talk to you and get your stories so they can hear it right from your mouth instead of they're sick of listening to me talk. So I like to bring guests in so they can share their expertise. Yeah,
well, I think that's a very humble thing to say. So I respect you for that, but I bet they love all that you have to share. Well, have a great day, and we'll see you again soon in another setting.
All right, thanks, Doc.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.